Hello everyone. In this video, I'll be discussing about Health Information System Part 1. The content includes components of Health Information System and its uses, sources of Health Information System, health records, environmental health data, population surveys, routine statistics related to health and non-quantifiable information. Let's have a look into the health information system in India. What do you mean by health information system? A health information system is a system that captures, stores, transmits, or otherwise manages health data or activities. These systems are used to collect, process, use, and report health information. Information from a health information system can be used to drive policy and decision making, research, and ultimately health outcomes. The expectations of a country's health information system serves multiple users and a wide array of purposes and opportunities that can be summarized as a generation of information to enable decision makers at all levels of the health system to identify the problems and needs of the community in terms of health, make evidence-based decisions on health policy, and allocate scarce resources optimally. So the data from different sources are used for multiple purposes at different levels of the healthcare system. Now, before moving on, we need to know further about the key components of the health information system. Basically, there are 6 key components for a health information system. The first one is the resources. The legislative, regulatory, and planning frameworks required for system functioning. This includes personnel, financing, logistic, support, information and communication technology, that is ICT, and mechanics for coordinating both within and between the 6 components. Then comes the indicators. These are a complete set of indicators and relevant targets which includes inputs, outputs and outcomes, determinants of health and health status indicators. Data sources includes both population-based and institution-based data sources. Data management includes collection and storage, Q&A, processing and flow, and compilation and analysis. Information products, data which can be analyzed and presented as actionable information, comes under this. Dissemination and use, the process of making data available to decision makers and facilitating the use of that information, comes under dissemination and use. The healthcare industry relies on a massive amount of data to make decisions about the patient care, facilitate the delivery of care, and handle the many complex administrative tasks that go on behind the scenes. Health information systems are thus valuable tools that aid clinicians and administrative personnel in ensuring a seamless patient experience from end to end. Let's have a look into the benefits of health information system. The first one is data analytics. Health information system helps to gather and analyze data to manage population health and reduce healthcare cost. Next is it supports collaborative care. Health information system facilitates the sharing of public health information between providers and organizations, thus making it possible for the patients to receive coordinated care from multiple providers while improving care delivery and patient outcome. The third one and the most important one is the cost control. By sharing information, Health Information System or HIS can eliminate duplicate testing and procedures, reduce the time demands of staff such as for sending paper copies of patient records, etc., and reduce costly human errors. Population health management is another benefit. Aggregating patient data can help to identify patterns and trends, predict or prevent outbreaks, identify at-risk population, and the like. Next one is clinical decision support. Integrating a patient's individual data and medical history with broader population data and research improves both diagnostics and treatment. So these are the benefits of health information system. It helps to have data analysis, supports collaborative care, cost control, population health management, and clinical decision support. Now, as I said earlier, data from different sources are used for multiple purposes at different levels of the healthcare system. So we have different types of data. Individual level data about the patient's profile, healthcare needs, and treatment serve as a basis for clinical decision making. Healthcare records provide the basis for sound individual clinical care. So these problems can arise when health workers are overburdened by excessive data and reporting. So there are some reliable sources for collecting this health information system, which we will move on one by one. Census, registration of vital events, sample registration system or SRS, notification of diseases, hospital records, disease registers, record linkage, epidemiological surveillance, other health service records, environmental health data, health manpower statistics, population surveys, other routine statistics related to health, and non-quantifiable information. Now let's have a detailed look into one by one. First one is the census. As we all know, census is taken in most countries of the world at regular intervals. In India, it is taken on every 10 years and the first regular census was undertaken in 1881. Census is taken in most countries at regular intervals and the total process of collecting, compiling and publishing demographic, economic and social data pertaining at a specified time or times to all persons in a country or delimited territory can be defined as a census. So it is a massive undertaking to contact every number of the population in a given time and collect a variety of information. So it needs massive preparation, several years to analyze the result after the census is taken. And this is a main problem of census as a data source, that is that the results are not available quickly. So the last census in India was held in March 2011. The Census Commissioner of India is considered to be the highest officer responsible for guiding and operating the census, although the primary functioning of census was to collect demographic information, that is the total count of the population, breakups of the population into subgroups such as age and sex distribution. But over the years, much more information is collected along with this, like the social and economic characteristics of the households, their living conditions like type of the fuel used, type of the house, their occupation, income, etc. So census data provides a framework of reference and it acts as a baseline information for any type of planning, action, research, whether it is in social science or in medical field. So population census provides the data used to compute health, demographic and socio-economic indicators. Next one is the registration of vital events. This we have already discussed in our module on population education. So unlike census, Registration of vital events maintains a continuous record of demographic trends. So, according to United Nations, it can be defined as the legal registration or the statistical recording and reporting of the occurrence of and the collection, compilation, presentation, analysis and distribution of statistics pertaining to vital events. So, what are the vital events? It includes live birth, death, fetal deaths, marriage, divorce, adoption, legitimation, recognitions, annulments, legal separations, etc. In India, the civil registration system mandates registration of birth, death and stillbirths. Vital events registration in India in 1873, Government of India passed the Birth, Death and Marriages Registration Act. Subsequently, the states like Tamil Nadu, Karnataka and Assam has passed their own acts also. So this vital event registration is sometimes unreliable because it lacks accuracy, timeliness, completeness and coverage. However, there is also lack of uniformity in the collection, compilation and transmission of data, which is different from even the rural and urban settings, and sometimes on multiple registration agencies. Sometimes multiple registrations may also occur through the health agency, panchayat agency, police agency and revenue system. So we cannot totally rely on this registration of vital events alone, but we can always have a cross comparison. Next one is a sample registration system. The civil registration system in India has a lot to be improved and would require a huge effort and time. Sample registration system or the SRS aims to provide reliable estimates of birth and death rates for the states and also at all India levels. So some of the features that ensures the completeness of vital events reporting are: see, the SRS are a representative sample of the population is covered and not the whole population. They cover the sample representative sampling and not the whole population. It is based on dual record system. So it includes first a baseline survey of sampled units, samples considered as a unit, and a baseline survey is conducted. Second one, it is followed by continuous enumeration of vital events of the areas by an enumerator. An enumerator is a person who is a volunteer from the community. And third is independent retrospective. 6 monthly surveys are done for recording birth and deaths which occurred in the preceding 6 months, and the number is then matched with the one reported by the enumerator, and that is how it is being adopted. Now the next one, notification of diseases. Disease notification is a practice of reporting the occurrence of a disease, that is a specific disease or health related condition, to the appropriate and designated authority. So a notifiable disease is any disease that is required by law to be reported to government authorities. The very good example is the COVID-19 outbreak. Effective notification allows the authorities to monitor the disease and provides early warning of possible outbreaks. So a notifiable disease is one for which regular and timely information regarding the individual cases is considered necessary for the prevention and control of that particular disease. So, the reasons for declaring a disease as notifiable can be many. It is of interest to a nation or international regulations or control programs. It can be a state or national or district incidents. It is based on the severity or the potentiality for rapid mortality, whether it is communicable or whether it is having potential to cause outbreaks, whether it is having that is this particular disease is having any significant risk of international spread, the socio-economic cost of its cases, the preventability, evidence that its pattern is changing. So in other words, we can also say that diseases which are considered to be serious menaces to public health are included in the list of notifiable diseases. So it can vary from country to country, within the same country, between the states, between urban and rural areas, etc. Next is the hospital records. See, the hospitals, as we all know, almost all the hospitals are having a patient record. So it can be used for a geographic sources of a patient, the age and sex distribution of different diseases and duration of the hospital stay, distribution of diagnosis, association between different diseases, the period between disease and the hospital admission, the distribution of the patients according to different social and biological characteristics, the cost of the hospital care, etc. Hospital information is useful in planning of health services. For example, it will help to analyze the bed occupancy rates, the duration of the stay, the cost effectiveness of the treatment policies is useful in monitoring the use of hospital facilities. So these are all about the hospital records. Thank you for watching. We shall discuss about the other areas in the part 2 video. Thank you.